Ken Landau, thanks for watching. Let's talk about Tylenol or acetaminophen. Synthesized for the first time in 1877. FDA approved it in 1951, went over the counter in 1960. Obviously, it's on the World Health Organization list of essential medicines. It's more than 600 different prescription and over-the-counter medicines. Drugs that vary from NyQuil to Vicodin. It's one of the most common ingredients in different medicines. More than 27 billion doses are taken every year just in the United States. It's estimated that 1 in 4 adults take at least one acetaminophen every single week. And acetaminophen, of course, different from the non-steroidal anti-inflammatory drugs, goes by the name acetaminophen in the United States and in Canada and Japan and Venezuela and Colombia. And basically in the rest of the world, it's known as paracetamol. It's also called APAP, APAP. It's an abbreviation for acetyl para-aminophenol. It's an aniline analgesic. It comes from the aniline dyes of once upon a time. It's the only drug in its class that's still used today, and it's a relatively simple molecule. It's in combinations of pain medicines and sleep medicines and allergy medicine, cough medicine, cold medicine. When it's combined with oxycodone, it's called Percocet. When it's combined with hydrocodone, it's called Vicodin or Norco or Lortab. It's Tylenol number 3. That means Tylenol and codeine. It's Fioricet. That's acetaminophen and butalbital and caffeine. Comes as a pill or a capsule or a tablet, or it comes as a gel cap or liquid suspension, rectal suppository, although the absorption is variable. Actually also comes as an intravenous form. Intravenous available 10 milligrams in 100 milliliters of liquid. For people who weigh at least 110 pounds, it could be given at a dose intravenously of 1 gram every 6 hours, although the limit should be about 3 grams a day. It's indicated for temporary relief of minor aches and pains, mild to moderate analgesia, maybe with a headache or a muscle ache or a backache or a toothache or a cold or a flu or a sore throat, menstrual pain. But it really isn't helpful for low back pain. It's not really good for osteoarthritis. It's okay as a fever reducer, and it doesn't really have any anti-inflammatory effect. So if you have an inflammatory condition like rheumatoid arthritis, this isn't the pill for you. It supplanted phenacetin. That was a blockbuster painkiller, but unfortunately it also killed the kidneys. It's less GI toxic than aspirin, and it's relatively safe when it's taken at its appropriate dose. What's the dose for adults and children? Well, 325 to 650 milligrams every 4 to 6 hours. The old idea that you could take 1,000 milligrams every 3 to 4 times a day, that's probably not such a good idea. There seems to be a limit on the amount of acetaminophen or Tylenol you should take in the course of a day, and it should be no more than 4,000 milligrams from all sources in 24 hours, and probably should be considerably less. As far as fever is concerned, the 650 milligrams is as good as 1,000 milligrams. As far as pain is concerned, 650 milligrams probably is pretty adequate. It's better for non-dental pain than it is for dental pain. If a child is using the medicine, have to be very careful of the dose. Shouldn't use an adult tablet. You should read the directions. It comes as an orally disintegrating tablet for children over age 2, and then the FDA has mandated that there be a standard dose to hopefully help prevent confusion. It's 160 milligram in 1 teaspoon, and it comes in a device calibrated in milliliters. Read the label and find out how much your children, depending on their weight, should be taking. Well, in 2010, the FDA said, you know, we ought to really consider reducing the maximum in 24 hours to 3,000 milligrams, whether you take it on a regular basis or whether you're taking it just periodically. And if you have a small body size, 3,000 milligrams, not 4,000 milligrams. And if you have liver disease, cut down to no more than 2,000 milligrams. They were actually going to ban the acetaminophen opioid combinations completely. But in 2011, the FDA backed down and said, well, we'll go for a maximum of 325 milligrams of acetaminophen combined with an opioid. But 3 years later, in 2014, only 50% of the companies 50% of the manufacturers had complied. So the FDA initiated proceedings that were going to take the drug off the market in anything more than 350 milligrams. So everybody cut down to 325 milligrams. Well, in the United Kingdom, they've gone a step further. In 1998, they limited the packet size. So in general stores, you can't buy more than 16 capsules at a time. In pharmacies, it comes in 24 capsules, and they're in individual blister packs, so it's harder to take a handful of them. And as a result, there was a dramatic decrease in the incidence of deaths. Now, the chemical was originally synthesized in Baltimore at Johns Hopkins University in 1877, first tried in humans in 1887, and in 1893, a paper looked at combining paracetamol with phenacetin, and what happened was that some of the people developed what we call methemoglobinemia, and they blamed it on the paracetamol. And as a result, paracetamol wasn't used for a long period of time, and the phenacetin actually put Bayer pharmaceuticals on the market. But in 1899, aspirin came out, and that really just knocked the acetaminophen for a loop. Well, the American College of Rheumatology says that acetaminophen is one of several options for arthritic pain, if you have it in your hand or your hip or your knee. They say it's a small benefit, but it doesn't reduce the joint redness, doesn't reduce the swelling, doesn't reduce the inflammation, but does have a painkiller effect that's similar to aspirin. As far as hip or knee osteoarthritis is concerned, it really doesn't seem to do much other than maybe help the pain a little bit. For low back pain, high quality evidence shows it's not really effective for acute low back pain, uncertain effect of chronic low back pain, and there's no significant change in the quality of life or your sleep quality or the global impression of your recovery if you happen to be taking the acetaminophen for the back pain. For more intense pain, it's combined with opioids for cancer pain or post-operative pain. For headache, for migraine headache actually, about 40% of the people going to receive relief at an hour compared to 20% of the people taking a placebo. So it works a little bit, but it isn't really a great therapy. If you have a tension headache, well, you might have to push the dose a little bit. For dental pain, it doesn't seem to work very well. If a child has a fever, the World Health Organization says don't treat it unless it's more than 101.3, and it's only for children basically who are over 6 years of age. Younger children really consider whether it's worth the risk. If you have a fever of unknown origin, just fever without anything else, it seems that the acetaminophen might be less effective than ibuprofen, but ibuprofen might be associated with the Rise syndrome, so acetaminophen might be a better drug to take. If you take it with food, you can delay the absorption of the medicine, especially if you're taking the extended release drug, but it doesn't increase the tendency to cause bleeding, so that's good. But unfortunately, unlike aspirin, doesn't prevent myocardial infarctions or stroke. Once you take the medicine, 60 to 90% is going to be bioavailable. It's going to be absorbed relatively quickly. On the other hand, if you take it with other drugs or if you take it with food, it might slow the absorption. The protein binding is very low, so most of the drug is in the active state. The peak concentration is going to be within 10 to 60 minutes. But again, if you take it with opioids or anticholinergic drugs or with food, it's going to delay the absorption by delaying the emptying out of the stomach. The half-life is going to be about 2 hours with a range of anywhere between 1 and 4 hours. The onset of action of the drug is within about 30 to 40 minutes. The effect lasts 2 to 4 hours. It's metabolized in the liver. It's conjugated with glucuronic acid 50 to 70%, with the sulfates 20 to 50%, and then it's excreted in the urine in a small amount is acted on in the liver by hydroxylation and deacetylation, and then it's conjugated with a chemical known as glutathione. Well, when it goes into the liver and when it's metabolized by the liver metabolizing, drug metabolizing enzymes in the liver, it's changed into a toxic metabolite. That toxic metabolite we call NAPQI. NAPQI stands for N-acetyl P-benzoquinonamine. And this NAPQI has tendency to cause problems, but fortunately, relatively quickly, the glutathione gives it a sulfhydryl group, and that converts it into a relatively harmless metabolite that's passed in the urine. But if the glucuronidation and the sulfation become saturated in the liver, then that means that more of the NAPQI is going to be formed. And if you happen to have depleted levels of glutathione, because you took too much acetaminophen, or if you're malnourished, then that toxic metabolite, the NAPQI, tends to build up in the system and causes significant liver injury. So the difference between a safe dose and a toxic dose is very narrow. So you have to consider the acetaminophen source from every kind of a pill you're taking. And even though it's widely known that you shouldn't take more than 4,000 milligrams in a day, a standard average hospital has at least one inpatient who is given more of the substance than that. Now, it interacts with a variety of other substances that might increase the toxicity. They would include drugs like phenobarbital and tegretol or carbamazepine or dilantin or the phenothiazines, drugs used to treat psychoses like Zyprexa and Seroquel. In pregnancy, there's the widespread perception that the drug is pretty safe, and about half of all women take the drug during pregnancy. It's generally safe. It's considered a category C. That means that the risk is not completely ruled out. And there's some evidence that mothers who take the drug while pregnant might develop or might have children who later on develop either asthma or autism or hyperactivity. So if you don't need the drug, don't take it, especially if you're pregnant. Well, there are some side effects, but they're pretty rare. Some people develop a rash or urticaria hives, and some people develop a small increase in the liver functions. The liver function tests show some abnormality, especially if you drink alcohol, you're malnourished, or you're taking some of those drugs I mentioned before that increase the metabolizing enzymes. There's a little bit of nephrotoxicity or kidney damage that might result from taking the drug, so we can see an increase in the BUN or the creatinine. And there's some decrease in the hematocrit, the red blood cells, and the white blood cells. Well, in 2013, the FDA had a warning of rare and potentially fatal skin reactions that are associated with the drug. So if a rash develops while you're taking the acetaminophen, you ought to stop, and if it persists, certainly see the doctor. If it seems to be severe, see the doctor. And in 2011, in the Journal of Clinical Oncology from the University of Washington, Fred Hutchinson Cancer Center in Seattle, they showed that regular users of acetaminophen who took it more than 4 days a week and did it for more than 4 years had an increase in certain kinds of blood cancer, non-Hodgkin's lymphoma, and plasma cell abnormalities. The incidence increased by about twofold over a period of about 10 years. But overall, it seems that there are fewer side effects compared to either aspirin or ibuprofen. Now, whether it really causes asthma or not is debated. Some recommend avoiding acetaminophen during pregnancy and even during childhood. Some of the formulations have sulfites in them. The FDA has mandated that there's a big warning label because in children who have asthma, the sulfites might precipitate an attack. And then if you take the acetaminophen, you probably shouldn't drink alcohol. And if you do drink alcohol, if you're a woman, you should definitely not have more than 1 drink a day. And if you're a man, you should definitely not have more than 2 drinks a day. Acetaminophen is a very common cause of drug overdoses. Drug overdoses in the United States, in the United Kingdom, Australia, New Zealand, all over the world. And it's top reason for calls to the poison control centers in a given year, more than 140,000 calls, more than 100 deaths because of acetaminophen. Probably responsible for more emergency room visits than any other legitimate legal drug that's over the counter, certainly. There are 2 different kinds of overdoses. There's the intentional overdose and a suicide attempt, and there's the unintentional overdose that accounts for about 50% of all overdoses. It's people who take the acetaminophen, and it's in multiple different products. They don't know what the products are, but they keep taking it, and the excess over time meaning over 3 days or so, might give you toxic levels. Now, by the time you get to see the doctor, you might have low level in the system because you've already taken the drug and now you seem to be getting better. but the side effects may persist. One of the most common reasons we see this is in people who are recreationally taking the combinations of the acetaminophen opioid. And people who take the high doses get into a lot of trouble, and so do people who are taking the alcohol. As a matter of fact, as I say, about 50% of overdoses are unintentional. About 40% of the people are taking more than one product containing acetaminophen, and 2/3 of those are taking the acetaminophen in combination with the opioids. Overdoses are increased in likelihood in malnourished individuals, people who have active liver disease, people who are drinking alcohol, and people who are taking enzyme-inducing medicines that cause the NAPK to be formed in excess. Now, we have to worry about elderly individuals. There's an increased concentration of acetaminophen, especially in frail elderly individuals, even with low dose. We have to have special caution in people who are over age 80 if they take the medicine, and certainly if a person is at risk for liver disease, chronic alcohol use, liver damage from hepatitis, low body weight, cardiac, pulmonary, renal insufficiency, or again, those drugs that increase the metabolism, increase those drug enzymes in the liver. Pediatric overdose, well, it's common when children are given the adult strength pills or failure to read the directions on the pediatric dosage, or even the improper interpretation of what the dose is supposed to be, or not waiting a long enough time to let the drug be active, saying the drug didn't work, and then giving the child another dose. Actually, the FDA mandated, as I mentioned, that all pediatric liquid forms come 160 milligram in 5 milliliters. Keep the drug out of reach of the children, because unfortunately it's easy to overdose on the medicine, and be very careful about dosing the children. If you overdose, there are several stages. So in phase 1, shortly after the ingestion, lasts about 12 to 24 hours. You have a little stomach upset, maybe some nausea, vomiting, maybe a little bit of anorexia, loss of appetite, sweating. You become relatively white in the skin. You develop a peculiar pallor. Non-specific symptoms, no loss of consciousness. You don't fall asleep. Then phase 2 comes after about 48 hours, and it occurs when you begin to feel better. You may still have some of that nausea and vomiting, but your blood pressure might go down. You might have hypotension. You might develop some right upper quadrant pain, an abnormal liver function test. You might turn yellow, jaundiced. And some of the tests to see how your blood coagulates are abnormal. And then you can develop some abnormal renal function. You develop renal tubular necrosis. And then still in phase 2, if we give you the antidote, which is called Mycomist, acetylcysteine, then your liver function will gradually get back to normal. But if you don't get treatment in time and you go into phase 3, there you have severe hepatic necrosis. About 3 to 5 days after you took the medicine, your symptoms, nausea, generalized malaise, goes on to confusion and then stupor. Your liver function test normally should be less than 40, go up to about 10,000. You develop lactic acidosis. The coagulation factors worsen. You can start to bleed, and then death comes from fulminant hepatic failure or brain edema or multi-organ failure or even infection. Now, if you can get past all of that into phase 4, recovery generally occurs, although there may be some long-term sequelae. Most of the time, it seems that you get back to normal. Well, if you took an acute overdose, and we know that you took the medicine, we know about when you took the medicine, then we can look up on a nomogram, looking at how much the concentration of the acetaminophen is in the bloodstream, and we can actually predict whether you're going to live or die. We can predict what the circumstances are going to be. And actually, we have another nomogram. It's called the King College Poor Prognostic Indicator in acute liver failure from acetaminophen. And what that does is it measures the pH of the blood. And if the arterial pH is less than 7.3, if you have some encephalopathy, if your coagulation time is more than 100 seconds and your creatinine, that's test liver, kidney function, is more than 3.4, then you're probably not going to survive. Well, compared to other causes of acute liver failure, When people have taken acetaminophen, the liver failure is of shorter duration, so it's not like alcohol that evolves over a decade or two. You have higher levels of those liver enzymes, as I said, up to around 10,000. You have a lower level of bilirubin, so you're jaundiced, but not really as jaundiced as some other people could be. And then you have that low arterial pH. Well, acute liver failure occurs when people have more than 3 grams or 4 grams, 3,000 or 4,000 milligrams a day. It's very risky if you take more than 7,000, 8,000 milligrams a day. And even if you're taking alcohol, the level that's safe is down to around 2,000 milligrams a day. And remember, that NAPQI, that binds to the liver cells, and it binds to the macromolecules, the DNA and the RNA and all of the proteins inside the liver cell, causes dysfunction of the enzyme systems inside the liver, causes structural and metabolic disarray inside the liver, causes death in the liver cells. And unfortunately, that can happen at relatively low levels. Remember, that 4,000 milligram, that doesn't count for everyone. You have to consider whether you're drinking alcohol, whether you're fasting, whether you're malnourished, whether you're taking phenobarbital or Dilantin or some of those other kind of medicines. If you do overdose, do we have any antidote? Well, certainly if we find you within 1 to 2 hours, it's possible to take some activated charcoal. Activated charcoal will prevent any of the acetaminophen that happens to remain inside the stomach from being absorbed. But we can use a medicine known as N-acetylcysteine, called NAC. If it started early, and we support the individual, and if the individual gets treated within 8 hours of the overdose, then we can probably improve the prognosis dramatically. If a person has an unattended overdose, so you took the medicine over a period of time and you just took too much, and now you finally get to the medical facility, well, the medicine probably isn't going to be effective. Well, when you use the medicine, it's oral medicine, then mica mist is diluted about 1 to 3 with cola or orange juice to mask the taste. You take a big loading dose, then you take additional doses every 4 hours for 17 doses, or you could take an intravenous medicine known as acetadote, and this unfortunately can cause some anaphylactic reactions in up to 20% of the people. The infusion initially is given over a period of 60 minutes, then a slower infusion over 4 hours. Then the infusion is considered at a slightly greater rate for a period of about 16 hours. Now, there's another medicine, and it's called calmangdafodipir, and this medicine is an experimental drug that's used, and it sort of replaces that glutathione. It seems to have beneficial effect. It's used sometimes in cancer chemotherapy to prevent some of the reactions to the cancer drugs. Well, the mechanism of action of acetaminophen is really not certain. It possibly involves the chemical mediators, the pain and the inflammation, probably in the brain and in the spinal cord. It's thought that it interacts somehow with the COX enzymes, but it's not much of an anti-inflammatory drug. It's certainly not an opioid. It's not an aspirin product, not an NSAID product, non-steroidal anti-inflammatory drug. Actually, the COX story, which is the story of aspirin, aspirin's COX inhibitor, well, it started off in 1972 when John Vane, who won the Nobel Prize, found that there was this COX-1 and COX-2 enzyme. Well, now it's reported as of 2002 that maybe there's a COX-3 enzyme. It's mostly in the brain. Well, there's a dog version. We don't know too much about a human version, but the COX enzyme seems to have 2 different receptors. One, a peroxidase site where acetaminophen works, and the other is the COX site where the aspirin and the non-steroidal anti-inflammatory drugs work. And it also appears there may be a completely separate mechanism of action, and that mechanism might involve something known as the transient receptor potential, the TRPV1 and A1. These are interesting channels, and they may relate to the cannabinoids. And it appears if we block the cannabinoid receptors from working, the CB1 receptor, if we block that from working, then we prevent the acetaminophen from working. That's sort of an interesting sidelight. Well, anyway, It can also have effect on the serotonin metabolism, might work that way. And psychologically, there is an idea that acetaminophen improves the social anxiety, and it does so by decreasing the activity of a portion of the brain known as the insula. That's where you have the emotional pain. And it would appear that acetaminophen changes some of the emotions and changes your emotional reaction to the pain. It doesn't change your judgment, but doesn't give you the highs and doesn't give you the lows of the pain. Now, there's a story about the extra strength Tylenol, the rapid release gel caps, the blue and white capsules that you see that have supposedly these laser drilled holes. Well, actually, those Tylenol gel caps seem to be more slowly absorbed than just the plain old Tylenol tablets you get in the store, whether it's a Tylenol or whether it's the generic acetaminophen. Actually takes longer with the rapid release gel to get it into the system, and it costs a heck of a lot more money. Well, that's Johnson & Johnson for you. They seem to have a lot of trouble right now. Trouble with their vaginal mesh in the lawsuits, trouble with the opioids in the lawsuits, trouble with the talc and the asbestos and all of the lawsuits. Well, in the United States, the first marketing was with Triagesic in 1950. That was a combination of aspirin and paracetamol and caffeine. That was the APC that some of the older individuals might remember. And in 1951, just shortly after it was released, there were 3 cases of agranulocytosis, so it was removed from the market. And after several years, it was decided that the agranulocytosis was unrelated to the APCs. So in 1953, Sterling Winthrop brought out Panadol. Panadol was prescription only, and it was for children and people who had gastric ulcers. Then in 1955, we had Tylenol codeine, or Tylenol, I'm sorry, children's Tylenol. That was brought out by McNeil Labs, and there was still some concern, so it didn't really get widespread acceptance until the 1970s, but by the 1980s, the sales of acetaminophen, Tylenol, far exceeded aspirin. And then we had the fall from grace of phenacetin. Phenacetin that was widely used prior to the 1980s, well, that was associated with analgesic nephropathy, kidney damage from taking the painkiller, the phenacetin, and was related to the blood toxicity. Well, if you're interested in some of the overdoses and some of the stories of the overdose, This American Life, that's a Chicago-based public radio, NPR, they had an episode entitled Use Only as Directed, and it highlighted the deaths from overdose with acetaminophen. And then there were 2 reports from ProPublica that alleged that the FDA was long aware of the toxicity of acetaminophen, and it was known to the makers of Tylenol. Johnson & Johnson knew about it, but they kept pushing it, and they didn't mention that there was the toxicity. So that's acetaminophen. It's a good pill. It certainly provides relatively good results, and it's certainly reasonably priced. But as with so many other pills, we just tend to take too many pills. So consider if you really have pain that warrants your taking a pill. Maybe just put ice on it. Maybe you rub some topical salve on the skin. Remember, don't exceed 4,000 milligrams, and good idea not to exceed 3,000 milligrams a day if you take the medicine. Be aware of other drugs that you're taking that might increase those liver metabolizing enzymes and then cause the acetaminophen to be toxic at even a lower dose. And as always, thank you for watching. If you have any comments, we'd like to hear from you. If you enjoyed the show, please tell a friend. Maybe subscribe. We appreciate your interest. I'm Dr. Ken Landau.